So the next thing we should talk about is really just the kind of thing we do a lot of, which is the full mouth restoration. And, not that long ago, some of the things we were doing were just dentures, right? Full mouth restoration was a denture. And we know, it's not a surprise that they're not a great solution. That was cutting edge technology with George Washington.
Yeah. Well, yeah. We've upgraded a little, but no big changes since the 1950s, right?
Sure, right.
It's a piece of plastic that you wear in your mouth, and a huge part of our patient base, our clientele, are denture wearers,
right?
Which tells us that we hear it every day. They're just not happy with them, and I can understand it. It's like losing your leg and getting a prosthetic that isn't attached, and you can't function well, and that's kind of what we see. We see, especially on the roof of the mouth, right? Having that plastic flange covering the roof of the mouth.
Oh yeah.
Affects speech. It affects taste. And then I think what I underappreciated a decade ago that I'm really keyed into now is the psychological impact.
Oh, for sure.
It's just like...
Well, people don't want to go out. They don't want to go out to dinners, be around family. They want to sneeze and have their teeth in their mouth.
Yeah.
They don't have to pull things out and clean it at the table. Yeah, it makes a big difference.
Yeah, and then, everybody's living longer too. I think there's that psychological thing of if your teeth come out and go in a jar before you go to bed, you're old. People don't want to be old.
No, of course. We're living longer, we're healthier, we're more health conscious. It makes a big difference. I completely agree.
Yeah, and to the health aspect, I think that's another thing that I appreciate more now is, and it's common sense, but you just don't think about it if you're not in that situation.
Well, of course.
Of when you're wearing a denture, you can't eat healthy food, right? Everything that's healthy is crunchy. Carrots, celery, vegetables, even a good steak. There's also research behind that too, right? About
sure.
The obesity. If things are too soft, you eat them too quickly. You eat too much, so it short circuits the whole biology that we're based on. To not have something that allows you to crush and grind up your food.
Of course.
Before you swallow it.
Well, we hear people all the time talking about gagging on their food and almost choking, or having had those experiences. They can't get it down. They've researched this, and it's not new research, but we know with the traditional denture, for example, an upper is at best about 30% chewing force, lower at best about 15%. So you've lost so much functionality. You're stuck with certain limitations of things you can eat. They might look okay until you smile too big, and then they fall down.
Yeah, that was when I was in public health. That was my pitch, right? It was, we'll make you this, but it's all show and no go.
And the best you can do, goop it all up with the glues and things like that, and it's never ideal.
Yeah.
Never ideal. And that's the difference, because now when you versus 10 and 30%, and now you can get them in a position with implants where you're at 90, 95%. They're as natural as you can get.
Yeah. Yeah, and I look at our progression through this process over the last decade is, 10 years ago we were doing a lot of overdentures. Right? And those are...
That's right.
An improvement over a normal denture because, for those watching, an overdenture is placing a couple implants that clip on or snap onto the denture so that it's retained in the mouth better.
Well, it replaced the glue, right? So now you don't have to do the glue, which was a big improvement.
That's an improvement, but I think at the end of the day, the problem is it's still a denture. And that's kind of what I bumped up against with my patients is, it's a better denture. It stays put better, but it still has the denture problems. It still has the flanges. It's still a piece of plastic that comes in and out.
Well, there's a lot of maintenance on it. You've probably seen it all. I do all the time. You come in, you have to replace the gaskets. You got to update this and that. Things will chip and break. And there's people are in much more frequently when they have those versus something that's more of a fixed option.
Yeah, to be fair, everything, natural teeth, fixed implants, everything requires maintenance if they want it to last. Just like a car, you got to bring it in for regular oil changes.
Sure.
But you're right. The overdenture with those little either rubber gaskets or the little nylon inserts, they just wear out.
They just wear out.
And it just becomes like an ongoing saga, right?
Yeah, 5-10 years ago, I was doing a lot of those. I've actually shifted completely, and maybe we talk more about the fixed option now. A lot of people hear them called the all-on-4s, fixed hybrid dentures, a couple different names for it. Some people have coined other terms, but essentially they're the same thing.
Yeah, absolutely. And we've gone back and converted a lot of those overdenture patients to a fixed option.
That's right.
And it's night and day better. Like I said, there's no perfect option, but the all-on-4 is as close as you can get to a set of natural teeth. I think you said 95% of the way there, and I think that's how our patients see it.
Well, and that they look natural. Well, I had a patient just the other day. She commented to me. She'd been at the cafe. The waitress came by and she said, "I just have to ask you, what's your secret? You have such beautiful teeth." You know, and she smiled to herself and she said, "Well, they're implant teeth, you know." But they do. They just look natural. She can order anything on the menu. She can eat anything she wants. She can go to the farmer's market, get fresh carrots, nuts, you know, you name it, anything she wants to eat. There's nothing off the table as far as eating options.
Yeah, that's a huge improvement functionally. Back to what I was saying about dentures, though, the psychology component of it.
Oh yeah,
that's what really blows me away is when they go from dentures into the glass at night, or you know, like you said, falling out when they're trying to eat with friends, to having something fixed and secure, then it just feels like their own again.
That's
like
right.
you said, they're implant bridges, but they start to feel like they've got their own teeth again. And just to see the social impact that makes for people,
That's huge.
has been phenomenal. You know, I can't count the number of patients that you see them back. It's fun, right? You see them back every 4 to 6 months for maintenance and kind of catch up on how life's going.
Family,
you know,
grandkids, traveling. They're focused on life instead of, you know, on the flip side, people coming in for relines, hard relines, soft relines, you know, making new sets of dentures. And the thing is, with implants, the bone stabilizes. And so we see this play out constantly. And with the traditional denture, you see this atrophy, right? And so it doesn't play out very well because you're going to continue to atrophy, where these are stable. And people, yeah, you're right. They just come in, they're just, you know, and I hear this 5, 6, 7 years later with the fixed set. People just look at me and they say, "Dr. Huish, you know, this is the best decision I ever made. The best money I ever spent. I just wish I would have done it sooner." They're just super happy with it.
Yeah, that's for sure. And I think for me, it's been fun to see people. You know, we have obviously different patients, different life situations, but you know, sometimes we get those patients that have made some poor decisions or just have gotten into a tough situation, and they're trying to get their life back together. You know, whether it was drug use or neglect or whatever other thing. And you know, I think that's, you know, we're obviously not psychologists and not licensed to do anything that way, but it's fun to be part of that process too, where, you know, they come in and it's kind of a broken person and we help them get that part of their life back together. And sometimes it just gives them momentum, right? They get their teeth fixed, they can get a better job. They, you know, relationship status changes. You know, so that's really fun for me to see too.
Oh, completely. It's a huge difference. And although we don't want to judge people on their teeth, as humans, it's something we can't help, right? We see someone's teeth and we tend to have a judgment. And so to be able to get someone from a place where they feel very self-conscious, a lot of men will grow large mustaches or beards, a lot of women will cover up, they'll wear masks around town, they'll try to cover things up, they're embarrassed. And for them to now come out and smile, you know, ear to ear, it's super rewarding, you know, and they're volunteering more, they're involved with family, they're, like you said, they're in the workplace. It changes everything. And to be a part of that, I feel spoiled to see this process play out over and over. And again, there's different reasons. One of my favorite patients recently, she'd gone through cancer therapy, lost her teeth. And what she said is when she got her teeth back in there, is that it's like she got a piece of her life back. You know, another go at this thing, which was a huge compliment, you know, and it just speaks to the value of this opportunity to start fresh again. And to speak to the health impact on having these teeth, it's connected. I mean, we're all connected, right? There's the connection to our immune system, less inflammation with gum disease, our gut health when we're able to eat healthier foods.
Well, and the big one is cardiovascular health.
Oh, it's huge. Ton of benefits there. There's a ton of research directly linking that.